majority was no federal funding for abortions in the House health care reform bill, but that was not enough for some conservative Democrats. In our fourth story in the countdown, an abortion amendment passed, which would restrict, as a practical matter, a woman's right to obtain an abortion. Congresswoman Diana DeGette of Colorado decrying the overzealousness of that amendment. She has reportedly collected more than 40 signatures from House Democrats who will oppose any final bill that includes in it, and in that letter, those signatures are in a letter to Speaker Nancy Pelosi. There's going to be a firestorm here, DeGette promised. Women are going to realize that a Democratic-controlled House has passed legislation that would prohibit women paying for abortions with their own funds. We're not going to let this into law. The Stupak Amendment, named for Congressman Bart Stupak of Michigan, not only prohibits abortion coverage in the government-run insurance plan, it also prohibits abortion coverage in private plans that are part of the exchange for the uninsured, if the person is using any government subsidies to buy that coverage. And practically speaking, the amendment would also lead to a wider ban of abortion coverage among private plans in the exchange, meaning that working-class women who are buying insurance solely with their own money would not have abortion coverage. Senate Democrats, including Bob Casey of Pennsylvania and Ben Nelson of Nebraska, are reportedly working to incorporate the same restrictions in the Senate version of the bill. President Obama telling ABC News tonight, quote, "This is a health care bill, not an abortion bill," and referring to the principle of federal funds not going to abortions, quote, "There needs to be some work or some more work before we get to the point where we're not changing the status quo." Let's turn now to the Washington editor of The Nation magazine, Chris Hayes. Chris, good evening.
Good evening, Keith.
So a health care bill that is supposed to increase choices and not get in the way of individual health care decisions passes with that amendment attached. A little odd?
It's really infuriating, and I think that everyone, the members of Congress, the members of the Democratic Party, women across the country, feminist men like myself, have every right to be really frustrated and angry at the Democratic Party, at the people that engineered this, and I think for the sort of tepidness that's come from some of the leadership about it. I mean, you know, it's very easy to second-guess strategic decisions by the leadership, and if the people that were threatening to vote against it really were going to vote against it, it's unclear whether Nancy Pelosi could have called the bluff. But if this is in the final bill, I mean, I think the Congresswoman DeGette is really right, that there's going to be a very significant backlash, and the Democratic Party has to think long and hard about whether they want to precipitate that.
At some point in this process, Mr. Stupak, who had the original amendment, had seemed to indicate that he wanted essentially his day in court, his moment on the soapbox here, and whether or not this was in the final legislation was less of an interest to him than was the process and getting his view aired. Was that by itself grandstanding, or is the reason there's not such a huge backlash against that because they're letting him have his moment of grandstanding?
It's really hard to game out. I talked to some sources on the Hill who seemed to be pretty confident it was going to get stripped out in conference. But you know what? Conference is a huge black box right now. I mean, first of all, we don't know what's going to be in the Senate bill. And then it's going to be very interesting who gets appointed to that conference committee, because they're going to have a tremendous amount of power. So, you know, it's very hard to say trust us right now after this has happened. I hope it is the case that the long-term strategic vision of the leadership in the Democratic Party in the House and in the Senate is to strip this out in conference. But, you know, right now, that all we have to go on is essentially a kind of a wink and a nod, and that's not quite enough.
And then in the Senate, Senator McCaskill said today she was not necessarily opposed to some sort of provision like the Stupak Amendment, and certain other Democratic senators will actually be writing, as we indicated, language like the Stupak Amendment in the Senate version. But how about the procedure in the Senate and how that might play out? Would it be significantly different than what we just saw in the House?
Well, the Senate is the place where sort of mediocre legislation goes to be made terrible, and so I would not be surprised if something, you know, equally odious as what happened in the House happened in the Senate. And let me just point out, you know, I don't want to sort of peer into the souls of these legislators, and some obviously, I think Bart Stupak has very strongly held convictions about the issue. From a pure political standpoint, I think it's just politically idiotic. I mean, the idea that this is going to win a single vote from a single pro-life voter is just crazy. I mean, if you know, I don't think that Clara McCaskill is going to sort of hedge herself or protect herself on her pro-life flank by supporting this kind of amendment, because at the end of the day, they know that, you know, she's not with them on judges, and, you know, they're not stupid. So I think the political calculation here is just massively flawed.
And since the president reintroduced this subject of standing up here and you're on the verge of launching Social Security, essentially, Mr. Gao, the Republican of Louisiana, got the message on that. Why are Senate Democrats and some House Democrats not getting the principal message as clearly as a congressman from Louisiana who happens to be in the GOP?
Well, I mean, in Gal's case, he's voting his district, and he's got about 65% Democrats in his district, and so he's voting his district. And I think, look, if you look at the 40 House Dems or 39 House Dems that voted against this bill, I think about half of them you can say, it was a cowardly vote, but at least it was voting their district. They really didn't have a whole lot of a choice. But about half of them either are from districts that Obama won, or in districts where they themselves have won very recently by massive margins. And so if you've been in the Congress and you can't go home and sell this to your constituents, something is very, very wrong.
Chris Hayes of The Nation. Something is always very, very wrong, as we know. Thank you, Chris.
Keeps us in business. Thanks.
Yes, indeed.